Question. A 55-year-old man presents with increased thirst, frequent urination, and unintentional weight loss over the past 3 months. His fasting blood glucose is 240 mg per deciliter, and HbA1c is 9.5%. He is started on metformin but returns 3 months later with persistent symptoms. Lab results now show. Fasting glucose 250 mg/dl. Postprandial glucose 320 mg/dl. C-peptide low. Anti-GAD antibodies positive. What is the most likely diagnosis? A. Type 1 diabetes mellitus. B. Type 2 diabetes mellitus. C. Maturity onset diabetes of the young. D. Latent autoimmune diabetes in adults. E. Secondary diabetes due to pancreatitis. Correct answer is D. Latent autoimmune diabetes in adults, LADA. The patient presents with features of diabetes mellitus, and while he was initially treated as a case of type 2 diabetes, additional findings suggest LADA, a slowly progressive form of autoimmune diabetes that occurs in adults. Key clues for LADA. Persistent hyperglycemia despite initial treatment with metformin, common in type 2 diabetes but doesn't explain the autoimmune findings. Low C-peptide indicates impaired insulin production, suggesting beta cell dysfunction. Positive anti-GAD antibodies confirm autoimmune destruction of beta cells, typical of type 1 diabetes and LADA. LADA typically presents in adults greater than 30 years with a gradual onset of symptoms, often misdiagnosed as type 2 diabetes. Why not the other options? A. Type 1 diabetes mellitus. Type 1 usually presents in younger individuals with a rapid onset and severe symptoms, often with ketoacidosis. B. Type 2 diabetes mellitus. Type 2 typically involves insulin resistance, normal or high C-peptide, and is not associated with anti-GAD antibodies. CMODY, a monogenic form of diabetes with no autoimmunity, usually presents in younger individuals. E. Secondary diabetes, seen in conditions like chronic pancreatitis or steroid use, which are not mentioned in this case. Treatment. Insulin therapy is typically required as beta cell function progressively declines in LADA. Early identification is crucial to avoid complications of uncontrolled hyperglycemia. Takeaway: LADA should always be suspected in adults with features of type 1 diabetes but a slower onset and initial misdiagnosis as type 2 diabetes.